Welcome to the Oncology Voice Network podcast, connecting the voices that move oncology drug development forward.
What makes the best medical affairs leaders different from everyone else? It's not just experience or credentials. It's something harder to quantify and easier to overlook. After 30 years in the life sciences industry and nearly 2 decades running an executive search firm focused exclusively on medical affairs, Tom Caravela has seen patterns most people miss. As the founder and managing partner of the Carolyn Group, Tom has placed hundreds of medical science liaisons, MSL directors, and medical affairs professionals across therapeutic areas. He's had a front row seat to what separates exceptional leaders from the rest. In this conversation, we're diving into what Tom has learned from that vantage point, the uncommon approaches the best leaders take, the career advice that's actually harmful, how the MSL role has evolved in complex therapeutic areas, and what skills medical affairs professionals must adopt to thrive in the decade ahead. Tom, welcome to the show.
Hey, thanks for having me. I'm excited to be here.
Let's start with you telling us about your journey. How did you first enter the life science industry, and what ultimately led you to focus on medical affairs and MSL leadership?
Of course, I'm 100 years old, so we got to go back a long way for me to kind of.
Well, I'm older than you are, so that makes me about 150. Okay.
You're 101. So, so I actually started as a rep. Right out of college, I got a job selling HMO plans for a company called US Healthcare a million years ago. I did that for a couple of years, and then I became a rep for Abbott Labs, and I loved it. I loved being a rep and did that for 10 years. And then accidentally on purpose wound up in the recruiting business. I was cruising along in my career. I met a couple of guys that were starting a recruiting company. It was really more of a consulting company on the IT side, like financial services systems. And I started working with them part-time and helping them out, and learned the recruiting business from the IT side of the equation. And that wound up leading to me getting this idea that, well, I could probably apply this, take this same knowledge and start my own firm on the pharmaceutical side. So that kind of had this entrepreneurial spirit, was, really wanted to do it on my own, ventured into pharma, and the rest is history. That was 25 years ago.
We always talk about successes, but was there a failure or an apparent misstep early in your career that ultimately set you up for success later on?
I guess to add to the story, it's really crazy the way this whole thing worked out. But so I was working part-time for this other firm, like I said, and it was cranking. I mean, it was just so successful that I quit my day job and I went all in with these guys. Right after that, 9/11 happened. So now I quit my job. 9/11 happens, which really, I mean, especially Wall Street financial firms took a huge hit, and that industry really went downhill. So now we are in a situation where that business isn't doing well. I can't go back to my other job. So that ultimately, that setback led to me making the decision to, at that time, say, okay, I either put up or shut up. And I started my own firm at that point in time. I took a chance. And a lot of people ask me, name of my company is the Carolyn Group. A lot of people ask me, like, where did that come from? Is Carolyn like your wife's name or something? So at that time, I had a partner, and his last name was Dolan. So we combined Caravela Dolan, came up with Carolyn. He only lasted like 6 months. It just wasn't working out. So I had bought him out, kept the name. I was going to change it, but I had landed, Bristol Myers Squibb was my first client. And I was talking to them and they're like, you can't change the name because we got you on the vendor list and the list is now closed. So we can't get you back on the list. So I was like, all right, Carolyn sounds good to me. And the rest is history. So the setback of 9/11 led to me deciding, okay, I'm going to take a chance and do this.
Well, at least you were smart enough to put your name first. So it starts with your name. And the Olin, everybody wonders, well, what's that about? So that's very interesting. Well, through your work at the Carolyn Group, you've had the opportunity to observe and support the careers of many medical affairs professionals across the companies and leadership levels. What perspective has your vantage point at Carolyn Group given you about how medical affairs organizations and careers should evolve?
It should evolve the same way a business, any business should evolve. And that's on relationships. I can't stress how important it is throughout your career, whether you're an entrepreneur in business, whether you're a medical affairs professional, an MSL, how important it is to develop and nurture relationships. You hear the expression, your network is your net worth. Having a strong network and a good community and really strong relationships that you can rely on. I kind of use this analogy that when you, let's just say, you have a great network and you have great relationships that you carry with you without your career, and you're going out to look for a job, it just makes it so much easier. It's like if you get in a boat to go fishing, you don't even have to throw your pole in the water. The fish just start jumping in the boat. And what I mean by that is people are always seeking you out for opportunities because they want you on their team. That is the difference between somebody that really establishes a career based on true relationships and somebody that's just going through the motions every day.
Well, that's interesting because we hear that many times, particularly about field medical and MSL. The relationships are so important. I'm not sure all the time that everybody lives that life. I mean, you certainly do. I see you all the time in social media. You're with people, you're at the conferences. I mean, you were really out with the troops. So tell me a little bit about how have you seen the role of medical, field medical, and MSL evolve over the past decade, particularly in complex therapeutic areas like oncology?
What I've seen, even from the beginning to now, but especially the last 10 years, it's just become so much more specialized. And what I mean by that is when I first started recruiting MSLs in 2002, we would get contacted by hiring managers and clients and talent acquisition teams that would say, hey, we have an MSL opening in the Pacific Northwest, and just find me a clinical pharmacist or a PharmD that has great communication skills. We've evolved to the point where now that same conversation is I need a PharmD BCOP with head and neck cancer experience that lives in Sacramento and, has, red hair with one blue eye and one brown eye. Like, I'm exaggerating, but it's very, very specialized. In this day and age, companies and hiring managers want subject matter experts. They want to have experts talking to the experts. So I always try to explain to people how important it is to lean into your strengths and lean into what you're an expert in, because that's what's going to get you noticed more so than being a generalist. We're in a time now where people aren't looking for generalists, they're looking for experts. And I think that that's the big difference, especially in oncology.
So let's elaborate that a little bit. When you look across hundreds of medical affairs careers, what patterns consistently show up among the very best leaders, besides having one brown and one blue eye?
Like, it when you see it, and it's really comes down to number one, the best leaders are the best communicators. You can see the confidence and the command of a real leader and how they communicate to people. It's a different pace. It's a different energy. It's a different vibe. There's a confidence in the way true leaders speak to others and how they carry themselves. I would call it an executive presence. It's not just the words, because in this day and age, I kind of feel like it's almost become normal to hear people just recite buzzwords. That's not the top true leader. It's the person that can communicate, inspire, impact, really influence others to take action, want to be better, be more motivated, or learn something from that person that brings them to a whole nother level. And that's a true leader. And you can see it in the folks that just bring that executive presence with them when they communicate.
So, when you look across companies, what's still broken in medical affairs? I mean, when companies build medical affairs teams, what mistakes do you see them repeat over and over again?
This is going to sound a little biased coming from the recruiting guy, like the recruiting firm that wants to build MSL teams. But I still think one of the biggest problems is I think companies wait too long to deploy their field teams. I think what happens is the intention is there, but it always seems like it's a rush. It always seems like, oh, we need to have our MSLs out there yesterday. We need boots on the ground yesterday. And I feel like, and I don't know if it goes back to the strategic initiative from the get-go, or if it's just, hey, we need to wait a little bit longer to get the compound further through the pipe, through the right phases and through the right process to understand whether or not we even can or should deploy a team. I know that there's that delicate balance, but it just always seems like it's a little bit later than it should be. And in some cases, it's a lot a bit later than it should be.
And I know you mostly specialize in medical affairs and MSLs, but what do you see are the biggest disconnects between them and the other functions, such as clinical development or commercial market access, that prevent organizations from effectively working together?
That's a great question. And I think it just comes down to communication. I still feel like in organizations that we're working with, and we do mainly work on the medical affairs side, probably 90% of what we do is medical affairs and MSLs, but there's so much, obviously interaction and crossover, but at the same time, the frustrations that we hear about as we're, recruiting on positions is the fact that things are still siloed, that the communication is not what it should be. And I think that when you look at the strategic goals of a business unit, such as medical affairs has their strategic goals, commercial has their strategic goals. Are they aligned? Are they communicated? Does the right hand know what the left hand is doing? And I know to a certain extent that they may not need to, but there should be better protocols and best practices for better communication cross functionally, interdepartmentally, so that these organizations are more aligned in their initiatives. And that communication, I think, is going to get back to what I was talking about with relationships. That communication is going to foster better relationships. So the commercial relationship with medical affairs should always be really, really strong. I think the communication piece will make it stronger.
So, a lot of people think of talent search people as somewhat transactional. You hire them, hey, get me a job and give me a well paying job. But you're also, as you're saying, it's important for you to be a good communicator also to advise your medical affairs people as they are looking for positions. Well, let me have you think about what's the worst career advice you see commonly given to medical affairs professionals?
I think one of the things, and I don't mean to get cliche, but sometimes you'll hear people say things like, 80% of life is showing up. And that's such bad advice because the real success happens in that 20%. Yeah, you get credit for showing up, no question. And you know what? You can probably go pretty far and maybe do pretty well for showing up 80% of the time. But the top performers, the people that really move the needle, are the ones that go the extra mile, the ones that are in that 20% that really makes a difference. And I think that there's no substitute for that hard work piece. What are you doing when no one's watching? Because the 80% of showing up is what people see. Like, what are you doing when people aren't watching? What are your habits? How early are you showing up? How late are you staying? That sort of thing. So I think that the best advice is the opposite. Yeah, show up, but put in the extra work.
Let's talk about the future a little bit too. So, besides some of the character things you've talked about, the communication, what new skills, mindsets, and technology do you believe medical affairs professionals must adopt to thrive in the next decade?
Well, couple things. And as you can tell, and you and I know each other pretty well. So, I'm a big advocate on a growth mindset versus a fixed mindset. I think in this day and age, you have to adopt a growth mindset. What does that mean? That means that every single day you wake up with intention and a purpose. You have goals, you're driven. You know the goals of the organization, but you also have your own goals that you're working towards. And by having that, that makes you intentional. That gives you something to work towards. Otherwise, you're just going through the motions. And in this day and age, it's too competitive. The environment's too competitive, the stakes are too high, and you're going to get left. But a lot of people don't realize, like, hey, why can't I get ahead? And I think it all comes back to mindset and not really having something that you're chasing. So that's number one. I think that what goes hand in hand with that is show me your habits and I'll show you a successful person or not. So what are you filling your calendar with and what do you do on a daily basis? What are your habits, routines and rituals? Because that is going to move the needle each day towards those goals that you're setting. So I think having a growth mindset, focusing on consistency in your habits are two of the most important things because everything else falls in line. And the other thing too is I think that it goes hand in hand with this, but I think that we're in a time, especially with MSLs, is that you need to be proactive. We are not in a time where you can just be reactive. And I feel like the best MSLs are the ones that are super strategic, they're proactive, they're out there, they're aggressive, they're go-getters, they're running their territory like it's their own business. They're the CEO of their own territory. You hear that term a lot. It's kind of a buzzword, but I think that it is a good way of saying you need to be entrepreneurial in how you handle your territory.
So, I know a lot of this comes from experience, and you certainly had it. You see a lot of people who have good experience out in the field, they grow in the field. But are there one or two books or resources that you would recommend to your colleagues and why?
I literally just mentioned habits. And one of the best books you can read is Atomic Habits by James Clear. It's such an impactful book. And like the one thing I like about Atomic Habits is it's the type of book that when you read it, it almost it doesn't force you to change your life. It encourages you and inspires you to change your life. You're like, why wouldn't I do these things? It really makes you pay attention. The other book there's a lot of books that I like and recommend, but the other book I really like for anyone, it's not just medical affairs, MSLs, really anyone, is a book called Never Split the Difference by Chris Voss. And it's not a book about negotiation. It seems like it is. It's not a book about negotiation. It's a book about communication and relationships. It just happens to be an FBI negotiator, a hostage negotiator who wrote a book and has developed courses and is a consultant. But it just teaches you so much about human interaction that it makes you think about how you handle your relationship with your spouse and friends and communicate with folks, not really just about, negotiating. So those two books I would highly recommend. And then, I'm a big podcast guy and I love doing podcasts, but I also love listening to podcasts. And my favorite podcast right now is called The Diary of a CEO. The host is a gentleman by the name of Stephen Bartlett. He's 33 years old. He's from the UK. He's an incredibly successful entrepreneur. He has such a great demeanor about him and gets amazing guests. So I'm actually right now, this morning, I was listening to an episode with Rhonda Patrick, who is the foremost leading anti-aging expert, talking about how dangerous visceral fat is. So I know that that sounds really enticing, but it's amazing. It's fascinating.
Yeah, visceral fat is always on my mind every day as I exercise.
Well, for me, I'm like, oh my God, I got to do something here. I better start fasting again, you know?
Well, we should both be good at that. We were both wrestlers. We know how to fast and to lose weight, but somehow you lose that skill as life goes on. Another question I wanted to ask you is, the OVN, Oncology Voice Network, and Voices of Oncology book was all about breaking down silos. As you said, networking, communicating with people, become closer. So I want you to think, if we were to accelerate innovation and improve outcomes for patients with cancer, what is the one silo in our industry that absolutely must be broken?
I don't know if it's the number one thing, but in my world and in the communication that I have with medical affairs leaders, there is that silo that exists from between medical affairs and commercial. And the way the relationship between the MSL and the folks on the sales side. And then I feel like the stronger the bond is, the MSLs that have the best relationships with their sales folks get the best outcomes. They're the best performers. And I feel like breaking down that silo and developing really strong relationships, sharing knowledge and insights with your commercial counterparts and vice versa is such a powerful 1-2 punch. Because if you look at the opposite, where it's like medical affairs is doing their thing, commercials doing their thing, and never the two shall meet, you're just really, it's like you're recreating the wheel every time you go out there. And instead of working as a team, you're working as individuals. So I just think that that could mean that always, and from what I have seen, creates such great impact. And it eventually leads down to patient outcomes because it's better and more consistent communication with the KOLs that need to know the information to make better decisions for their patients.
Tom, it was such a privilege to talk to you today. And thank you very much for your time to discuss very interesting insights from your 100 years, I think you said, of
100
experience.
years. Yeah, 101.
101, from both working with talent search, but also from, and I know this number is more accurate, a few hundred podcast interviews you've already performed, which a lot of people love. So I appreciate your personality within our industry. You're a connector. And again, hopefully we'll do it again.
I love what you guys are doing. I appreciate this opportunity and appreciate our partnership. So yeah, I'd love to come back anytime.
That's it for this episode. I'm Dr. Kirk Shepard. Thanks for listening and for being a part of the conversation that's moving oncology forward.